Now, we're all busy, but during this pandemic, it seems like there's a lot more to worry about than our more quiet chronic health conditions. Today, we're talking to Dr. Rachel Hartline, a family physician at Upland Hills Health, about the seriousness of leaving high blood pressure and high cholesterol issues untreated. This is the Inspire Health podcast from Upland Hills Health. I'm Caitlin White. So, Dr. Hartline, why should I care about high blood pressure and high cholesterol?
Yeah, that's a really good question. It's not something that necessarily you'll feel many symptoms of until it's kind of caused too much damage. High blood pressure and high cholesterol both affect your blood vessels, and they cause them to narrow and kind of not function as optimally as we'd like them to. And that over time puts you at risk for big things that you do care about, like heart attacks and stroke and vision loss and poor kidney function.
Now, I hear about statins and medicines that my grandparents are on for high blood pressure. Can you break down some of these different options for medicines?
Yeah, there's a lot of different options for medicine. For high cholesterol, statins are one that get a lot of buzz because they're ones that, again, like most of the medicines for these type of problems, you don't ever really feel the good effects because the effect is preventing a stroke or a heart attack you didn't have, but they may have side effects that you do notice. Statins get a lot of buzz because they're one of the ones actually that has the best evidence of preventing problems down the line. So, when we think about cholesterol, you probably think about the numbers, and the numbers are important, but what's really important is preventing those heart attacks and strokes, and statins are the category of cholesterol medicine that we have really good evidence that shows it prevents those heart attacks and strokes rather than just makes the numbers look better. There's a few other things that can be helpful, especially in people who, try their hardest but really just can't tolerate a statin very well, but statins are kind of the mainstay as far as cholesterol medicines go. For blood pressure medicine, there's a lot of really dozens of choices in a few different categories, but a lot of them sometimes can do double duty for other conditions that you may have. So they can do things like protect your kidneys if you have diabetes, make your heart pump better if there's a reason that your heart's not functioning optimally. They can treat things like tremor or anxiety, and in men sometimes you can get a blood pressure medicine that helps with your prostate. So there's really a lot of choices out there, and it's a good idea to talk with your doctor about other concerns that you might have that we can address maybe with a blood pressure medicine as well.
Now, you mentioned that, you don't feel the good effects because they're preventative, and then some of the side effects that medicine has. Can you tell us more about those?
Yeah, so the side effects, it really depends a lot on the medicine that you're taking, and honestly, most people will take the medicine and really not notice any significant side effects, but there's always a sizable minority of folks who take something and notice it. It depends on which medicine you're taking, which side effects you may notice, but for example, with statins, a common side effect is muscle aches or cramping. And sometimes we can help people with that by having them take it at night or to take a supplement called CoQ10 that can sometimes decrease the chance of that happening, or switching to a different medicine in the same category. Sometimes you have more side effects with one than with another. So there's lots of ways to sort of work around that problem if it comes up. But at the same time, knowing that it's a medicine that you're only going to prevent things, you won't necessarily feel better having taken your statin.
So if I have high blood pressure, high cholesterol, and I don't know it yet, are there symptoms that I'm probably feeling, or is it completely kind of an invisible condition?
Yeah, a lot of times it's completely unbeknownst to you. That's part of why we think of them as kind of the silent killers. If your blood pressure gets really high, sometimes people will have a headache or they notice chest pain or blurry vision. But that is a lot less common than the kind of low-level high blood pressure that your doctor's office picks up on. But you say, "Oh, I feel fine. I don't know if that's really anything. I'm just nervous to be here." A lot of times we have that discussion of, "No, I really, this has been happening over time." And that poses a risk over time. That's part of why your doctor probably more concerned about it than you might be, is that low level over time can also cause changes to your blood vessels. Even though it's not an emergency, it's something that we should help reduce your risk with.
Is there anything for people who maybe don't want to go on a daily medication or something I could pick up at the drugstore?
Yeah, so there's lots of ways to kind of lower your blood pressure and cholesterol risk. And so it starts with what you're putting into your body. So your diet is the biggest thing that can impact changes for most people. So the less processed food you're eating and the more kind of stuff you were eating that was recently alive, either it was like growing from the ground, came from a tree, was on four hooves, those type of things, when they've been, not add a bunch of things added to them at the potato chip plant or whatever. It doesn't come necessarily from a bag, but from a farmer's market or even the grocery store, but someplace that sells things that were recently grown. That's like a good rule of thumb for kind of how to eat to lower your blood pressure, because most food that gets kind of processed is going to have a lot of hidden salt in it. And food that you prepare yourself, you know how much salt is going to be in something. But if you get it at a restaurant or get takeout or something, a lot of times those things, make things taste better. And so there's a lot added behind the scenes that you don't necessarily know about. But salt is one of the biggest things that can affect in terms of blood pressure. And then in terms of cholesterol, the more you can focus on those kind of foods that have, that were recently growing, that is a really good way to approach things. More fruits and veggies.
So with this being such a silent killer, like you say, it makes me think that people might not take it as seriously as other diseases because they're not feeling it. What happens if people kind of throw it to the side or don't really take it that seriously?
Yeah, over time, it just increases their risk of problems. So, uncontrolled high blood pressure for a long time can cause damage to the kidneys. It can cause damage to your vision. And the biggest, event that can happen is heart attacks and strokes. Strokes are kind of where the blood flow to your brain gets disrupted, and that can happen because those blood vessels aren't behaving the way that they're supposed to.
Great. Doctor, anything else you want to add to this conversation about high blood pressure and cholesterol?
I think the other thing I would add is that there's a lot of times that, I think there's a lot of times that your doctor thinks you're taking your medicine and you're not necessarily, and we can't help you unless you're being honest with us. And so we, try and ask questions in an approachable way. But if we're not getting to the heart of things, or if we don't have that accurate knowledge, we can't help you very much, or help you as much as we'd like to anyway. And the other thing I would say is that there's a lot of barriers in terms of cost sometimes, and it's not easy for us to know how much things are going to cost when we send them, because there's so many different insurance plans. So if you get to the pharmacy and discover this is more expensive than what you can afford, or what you want to afford, definitely call us back and we can work around. There's a lot of, especially blood pressure medicines, that are on the generic $4 list at most pharmacies.
Well, thank you so much for your information and your time, Dr. Hartline. To learn more, you can call 608-930-8000. That's 608-930-8000, or visit us online at uplandhillshealth.org. Thanks so much for hanging out with us. This has been the Inspire Health Podcast. I'm your host, Caitlin White. Stay well.